Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano, and today the folks from Mannett Community Health Center here in Quincy are joining us to talk about the Massachusetts Healthcare Connector and how you might be able to benefit from that health insurance program. First, though, we take a look at the weather and the news for you. Currently in Quincy, it's pretty nice, 42 degrees under partly sunny skies. The morning fog has cleared out. The clouds will increase throughout the day. It'll be mild, highs in the mid to upper 40s this afternoon. There is rain on the way this evening, probably after the evening commute and then lasting into the overnight hours. Lows tonight, not that cold, only around 39 degrees. Kind of unsettled for this weekend as well. A lot of clouds around for most of the day tomorrow. Some afternoon showers, still pretty mild as our January thaw continues in the mid 40s. It'll be rainy tomorrow night, probably heavy overnight with lows dropping off into the upper 30s, but improving here on Sunday with partly cloudy skies. Still pretty mild for this time of year, into the low 40s, and a little cooler on Monday with a mix of clouds and sun, and a high about 38 degrees. 42 in Quincy right now. Checking out the news for you today, Quincy Mayor Thomas Koch is putting together his priorities for the new Quincy City Council that was sworn in this past Monday night. The mayor says he looks forward to working together with both the new and the two returning city councilors.
You know, I know that sometimes they probably feel I've been in too long and don't listen. I don't necessarily obviously agree with that. I think they should continue to listen and focus. And it's one thing being an activist on the outside. It's another thing to govern. We got to come together and make decisions. That doesn't mean we're always going to agree. And I certainly hope there's times we're able to agree. But listen, the conversations that have been held publicly about transparency and openness, listen, I'm all for that. Council meetings, if they want to go, 10 hours, we'll be there. We'll answer every question that comes up and work with the new councilors and look forward to that. I've always been a big fan of deliberation and, answering every question, vetting every issue. And even at the end of the day, you can't come to agreement on everything. People have different opinions, and that's okay. That's all right. So look forward to working with everybody, and, hopefully we'll continue to get things done for the city of Quincy.
Koch also says that he anticipates delivering a State of the City address on February 9th at 6:30 at Quincy High School. Returning Councilor at Large Ann Mahoney was unanimously elected City Council President by her peers this week. Mahoney advised the new councilors that they should work to gather all the facts of an issue before casting a vote.
We have to remind the administration that we can't vote things unless we have the information and feel confident about what we're writing. So there'll be no rush to, we need to get this into committee, out of committee, and voted on tonight without the proper information. And unfortunately, that type of transparency hasn't been happening. It's more of a, we need this done tonight. And it happened when I was in the council too, and I certainly didn't appreciate it because they can't be handed something, a 40-page document, and be told it's just basic things that are changing, nothing to worry about here. I like to read things, and I'm pretty thorough when I read things. And if I don't understand something, just as the advice I've given to other people, make sure you ask those questions because once you vote on it, it's done.
Now, Mahoney also said that she will be allowing a public comment period during some of the city council meetings. However, she cautioned that there would be time restrictions and that there would be no reply from councilors during the public comments. Next city council meeting will be held on January 20th at 7:30 at City Hall. State Auditor Diana DiZoglio was the featured guest speaker at this week's City Council swearing-in ceremony, invited by new Ward 5 Councilor Maggie McKee. DiZoglio said she came away with some good feelings about the city after attending the Quincy 400 Flag Day Parade last year.
I have to say I was inspired. Look, I travel a lot around communities across the state, across the Commonwealth. There are 351 cities and towns. I hail from the great city of Methuen. I know, a North Shore Merrimack Valley girl. Thanks for having me here, everybody. We appreciate it. But it's so great to see a community like this big, still have that ability to come together in that tight-knit fashion. And you can tell that Quincy just gets it. Quincy gets it. Quincy understands that people come before politics. Quincy understands that people come before profits. Quincy understands that people come before power.
DeZoglio also says she felt that politics is dividing the nation and the state right now and called on the new city council to be a unifying voice and to advocate for their constituents. Quincy School Committee member Catherine Hubley is the new vice chairman of that committee for the next 2 years. Hubley was elected vice chairman unanimously by her colleagues at this week's committee organizational meeting. Hubley served on the committee since 2012 and says she has learned how to prioritize important educational issues.
It's not all about what I believe is best, but what's the best decision for the entire school system, including all students, parents, guardians, teachers, and staff. We must all have open minds and be open to listening to other points of view to realize that the view we hold may be right, but not right for the many that we represent. We have extremely important items to discuss that we need to focus and that need our focus and that affect the day-to-day of all students.
Hubley did previously serve as vice chair of the school committee back in 2014. Her husband, Walter, is the newly elected Ward 3 city councilor. And new members, Tom Leung and Kate Campbell, and returning member Tina Cahill were also sworn in for 4-year terms. And also this week, Superintendent Kevin Mulvey was once again appointed secretary and Laura Owens appointed clerk. The mayor serves as the chairman of the Quincy School Committee. 3 Quincy firefighters were recently promoted. During a ceremony held at City Hall last month, Derek Monroe was promoted to a captain, and Mark Whipfler and Andrew Moshe were both made lieutenants. Acting Quincy Fire Chief Gary Smith said the healthy number of firefighters on the department helps to save lives and property.
For us, we're putting these house fires out early, but what we're really doing is we're saving the homes of our citizens. You know, homes that they have a lifetime of memories in, that are invaluable to them, that have personal belongings. And we're doing such a service to our community because of where our department is at. I'd like to take a moment. I see Lieutenant Chris Murphy, one of our union officials, and all of our firefighters from Local 792. Tom Bowes, our union president, is on vacation and couldn't be here, but thank you to all of you for the work that you do each and every day to advocate for our department. It certainly means a lot, and we're certainly seeing the results.
9 new Quincy firefighters also recently graduated from academy training. That is our check of news for you today. Coming up, some changes to the Affordable Care Act may be impacting your health insurance this year. We'll learn more about that next. Welcome back. The open enrollment period is underway for the Massachusetts Healthcare Connector program, and the folks at Mannett Community Health Center here in Quincy can help you with that. So Shirley Fajardo and Ken Moore are with us this morning to tell us a bit more about how Mannett and about how the program itself may impact you. Welcome. Happy New Year to both
Hi,
of
Joe.
you.
How are you?
Happy
Thanks
New
for
Year.
having us. Happy New Year.
Pleasure. Ken, welcome back. We've had you before. Yeah.
Yes.
And Shirley, welcome for the first time, but hopefully not the last time. Right?
Thank you.
Yeah. We probably start with you if that's okay.
Yes, of course.
Give us a little bit of an overview for folks who don't know.
Yeah.
It's been only 50 years or so, right?
Yeah.
Mannett Community Health Center.
Yes,
Tell
of
us
course.
about it. Yeah.
So we are a federally qualified community health center. We offer primary care for families and individuals of all ages, but we also have integrated services like behavioral health. We have nutrition services. We have chronic disease management, care management. We also have radiology, vision center on site. We have an on-site pharmacy, which is pretty pretty amazing. So we do a little bit of everything. We have navigators that can help with insurance. We have community health specialists that can help connect people to social services in the community. So our goal really is to be able to take care of the individual as a whole and be able to tackle anything that could be affecting someone's health.
Yeah.
We have a couple of different sites. We have 4 different sites in the Quincy area. We have 1 in Hull, 1 in Attleboro, 2 in Taunton, and I think
I'm in Braintree, South Charlotte. The services.
yes,
so I
and we
think
also
that should-
do for some of our programs. We go into off-site locations.
Sure, I know you've been at the Kennedy Center here in Quincy
Yes.
in the past, presenting different specialty programs. There's a very active mental health counseling portion of Manat as well.
Yes,
I know that
yes.
folks should look into.
Yeah, we're
And-
big into behavioral health.
Yeah, and we should mention it's available to anyone, right? There's no
It is available to
limits.
anyone, yeah.
Yeah. Some people may have an impression that a community health center is only for folks of certain incomes. Not
No,
true.
no.
Yeah.
We're open to anyone in the community
Right.
who's looking for care.
Except both public and private insurance too, right?
Yeah,
Yeah.
absolutely.
So just to kind of lay the groundwork there,
Yes.
so you're available. About how many patients do you serve roughly? Do you have any idea?
Oh, I don't know that
Yeah.
number off the top of my head, but I mean, we're in the thousands.
Yeah,
we
definitely.
serve a lot of people.
Yeah.
And still taking on welcoming new patients.
Okay.
So
Okay.
anyone who's looking for care, we welcome you.
Open arms.
And are there
Mm-hmm.
also positions available at Manat, do you know, for healthcare providers?
Yes, we are always welcoming providers, nurses. We have positions available for care managers, community health specialists. We do have positions available, which people can go into our website, managechc.org,
Yep.
and go into the career section. They'll be able to see a list of any open positions.
Okay, all right, very good. But as I mentioned earlier, we're in the middle of the open enrollment
Yes.
period, right, for the Mass Healthcare Connector program. And that's where Ken comes in.
Yes.
Because you are a certified navigator.
Yes,
Ken,
sir.
to help folks kind of feed through that process, which can be
Yes.
a little daunting at
It'll
times.
be a little daunting,
Yeah,
yes. Yeah. So I am a navigator at Manat Community Health Center. Basically, open enrollment time is now. It's from November 1st to January 23rd.
Okay.
And it's very important to do everything before the 23rd
Okay.
because in case if you have to, are on a Connected Care plan or a Health Connector plan, you have to pick and pay for that plan before the 23rd of the month, so you'll be on for the 1st of the next month onto your
okay.
Connected Care plan.
Okay, so
Yeah.
time is of the essence
Time
right
is of
now.
the essence.
Yeah.
Time to come and see us now.
Okay. What is the Massachusetts Healthcare Connector, Ken?
Yeah. So the Health Connector is basically the marketplace where people would come in and they would apply for state health insurance,
Okay.
either Mass Health or the Health Connector. So there's Mass Health Connected Care plans as well as Health Connector plans. So the application that we submit in would evaluate you for all 3 of those plans and let you know what plans you have available, the prices.
Okay, and then you help them kind of navigate what would best fit their needs. right?
Yes, so
Yeah.
when people book an appointment at Manat, they get an hour consultation. We would sit down with them, we'd get into their profile on the Health Connector, and we would update their family size, income, and immigration status.
Okay.
And then it would give us a determination of what plans they're eligible for them or for their family, and what the prices would be.
Okay, all right. And through the Healthcare Connector, can you get either the public program, the Medicaid, or private programs as well?
Oh no, it would just be basically plans that are offered through the state.
Gotcha.
Yes.
Okay, I didn't realize there was more than one. So how many are there?
How many plans?
Yeah.
Oh my goodness. I mean, under the Connected Care,
Yeah.
there could be like maybe 8 different plans.
Oh.
Under the Health Connector, that if not many more, because the Health Connector plans are so that they go in tier. So you could do bronze, silver, gold,
see.
platinum
Okay.
for the Health Connector. But those are plans that don't offer advanced premium tax credit. So they're a little bit more on the higher side with deductibles. The Health Connector offers Connector Care plans, which are affordable health insurance plans that could start at $0 a month.
I see. Okay. Now, are there certain guidelines that folks have to meet in order to qualify for those programs?
Yeah, so when you come in during the consultation, you would want to definitely bring family information as far as names, socials, dates of birth, stuff like that, income documentation and citizenship documentation. I would put all of that information into the portal, and it would let us know what they're eligible for. And some people could be eligible for Mass Health, some people could be eligible for the Connected Care or the Health Connector. It could vary between the members of the family.
We really need someone like you to
I'm
navigate.
here for you, my friend. I am here for you. It's definitely not the easiest thing to navigate, but we try to make it extremely easy, so it's no stress and pressure on you.
Okay, all right. Now, there's been a lot of talk lately about the end of the federal subsidies from the Affordable Care Act.
Yes.
How is that impacting the Massachusetts Healthcare Connector program?
So the advanced premium tax credits basically are expiring or have expired, and now in 2026. And the advanced premium tax credits were put together back in 2021 to help offset and lower prices for premiums that people would be facing. And so the Big Beautiful Bill took that away from us as of 2026. But I did hear that Governor Haley in the administration, as of yesterday, stated that they were going to be offsetting that premium by donating, I believe, investing, should I say, $250 million to offset the effects of the advanced premium tax credit. So I just would like to say thank you to the Haley administration. That is so big for so many people in Massachusetts. It's going to make amazing savings. So thank you very much.
It's I have the release right here from the governor's office coming from the Commonwealth Care Trust Fund. You know, she did caution that it's just for 1 year, so this is just kind of a temporary fix.
It would definitely take a lot to fund, what the federal government has been doing for people by offsetting the advanced premium tax credits. But even a year for people to save and maybe prepare for the next year is still a blessing. So thank you.
Okay. And it goes on to say, just in terms of eligibility, the threshold applies to an individual who earns up to $62,600 or a family of 4 earning up to $128,600. So if you meet those thresholds, you would qualify.
You would qualify,
for
yeah.
a program,
and that's really big because not only is the premium low, but it usually comes with no deductibles.
Yes.
And we all know that a regular deductible could be $2-3 grand, but for a family it could be $7, $8, $9 grand, and that's just amazing savings.
Yeah, absolutely. So it keeps. There will be a slight increase in their monthly premium, but not as much as it would have been without this assistance from the state.
Yeah, so good.
That's huge.
So that's great news. Yeah.
So were you seeing that kind of manifest itself?
Oh, I've seen some astronomical bills.
Really? Really?
I've seen people come in with a $91 monthly premium, and their premium in 2026 was going up to $1,100.
Oh my, really?
And it was, and the only thing that person would have been eligible for now would be either Mass Health Limited or Mass Health Safety Net, which is an assistance program. So big changes for people.
So there's significant circumstances and consequences for the actions that have been happening.
Absolutely.
That folks need to be aware of. Now, if folks have been enrolled in the program, Ken, before, do they have to reapply?
Yeah, so people should reapply yearly. Like they would send out a renew form to people's homes and say, we're going to give you a certain amount of time to come in, update your family size, income, and immigration status to make sure that you're eligible for the next year. But they did say in 2026, maybe late 2026, that there were going to be changes in open enrollment. The renewal process could be every 6 months. So we're still waiting to hear more on that and when it's going to maybe happen.
Yeah. All right. So would folks be notified about that?
Oh, yes, way in advance, yes, yes.
I was going to say, they can't make these changes and not tell
anybody. Not overnight, no. They would definitely give people ample information and when they would need to come in.
Okay, all right. And I guess a couple of things we should distinguish. First of all, this is not the SHINE program, right?
No.
Separate from the SHINE program?
Yes, definitely.
Okay.
Yeah.
What is the SHINE program?
So SHINE is serving health insurance needs of everybody, and it's basically for people who are turning 65, getting into Medicare, or people who may be under 65 with an injury, illness, or disability that's going to last more than 12 months. They would be eligible to come see a SHINE rep.
Okay, so that's separate from the Healthcare Connector.
Yes.
Okay.
Yes.
And there is a hotline, navigation hotline at Mannett that folks can call, right?
Yes, we do. Yes, it's an amazing number. We've been getting a lot of great calls, and it's sort of a way of giving people a little bit of relief,
Yeah.
Over the phone before we can get into the big meeting.
So this is a live person that they'll talk to?
Oh yeah.
Okay.
Oh yeah.
All
We
right.
get right back in touch with them. We have so many different navigators that are waiting to hear from you.
Okay. We're on the screen there, 857-403-1557.
Absolutely.
Or through the email as well, through the website as well. And another thing we should point out, you don't have to be a man of patience, right?
Absolutely not.
Yeah.
No. And all the different Managed communities that we're in, communities that Managed is in, you can make an appointment. You don't have to be a Managed patient. We'd love for you to be a Managed patient
Sure.
if you're looking
Yeah.
for
And you
services.
could be.
And you definitely could be.
Right.
But we're more focused on just making sure that you get into the correct insurance and help relieve a little bit of that stress that's going on.
Yeah,
out there.
absolutely. You mentioned stress. Surely Managed does have a program, right, to help folks deal with stress-related issues.
Of course,
Yeah.
yeah. If people are stressed and they are looking for therapy or someone to talk to, they can tap into our behavioral health services if they're looking for that.
Yeah, absolutely. Are you seeing that, come to fruition at Managed? Are folks
think
coming
in
to you with those
general,
problems? Yeah.
Yes, absolutely. I think in general, people are going through a stressful time. So for any of our patients, we want to make sure that they're aware of all of the services that we have available. And as they communicate to us, whether it is when they meet with the navigators, when they meet with our community health specialists, or with any of our providers, we want to make sure that they know that we do have clinicians available that they're able to talk to if needed.
Yeah, absolutely. So, Ken, when somebody sets up a meeting,
Yes.
And they physically come in, right?
Yes.
Sit down and meet with you.
Yes.
Take us to what that looks like.
Oh, it's a fun time. Because basically you really get one-on-one with a person.
Yes.
They come in and their main issue could be health insurance, but then we find out more things about them, So basically we will sit down, really just get to know you, find out your family situation, find out your income situation, immigration status, update everything for you and walk you through it. And then once all the information's in the system, I would present the plans that they're eligible for. I would explain the plans, make sure that their primary care doctor is in the plan.
Oh, that's important.
Very important. And just make sure that they're comfortable with the choices that they're going to be making.
Yeah. After that, what happens? How long does it take?
After that, they would wait for a letter. Well, usually, honestly, by the end of the meeting, I can let you know what plan you're eligible to get into. If it is a mass health plan because of the income and family size, then you would be on possibly as of that day with Mass Health.
Okay.
If it is a Connected Care plan, usually if there is a premium involved, all of the Connected Care plans or Health Connected plans start on the first of the month. So if you do pick a plan that day with me, we would maybe book another appointment for you to come in to make the payment. Because you sort of can't pick and pay at the same time, at the same day, because it has to register. So once that happens, you'd come in with me, we'd make the payment online, and then at that moment I'd give you a confirmation number from them showing that it was paid by the 23rd of the month, and then for the first of the month you will be enrolled in whichever health insurance plan that you chose, and you'll receive your card and your welcome booklet and everything
I was
from the
going to ask
insurance
about
company.
you.
Oh yes.
So you get a card just like a private plan?
Oh yes, yeah. Oh, there's a lot of great plans out there. They have WellCare, WellSense, Tufts, Fallon, Blue Cross. There's so many great plans. All of the great
major
plans are out
ones,
there. Yeah.
And is it good for, that's just 1 year, is that right?
That is for 1 year. So
Okay.
definitely the Connected would send out review forms or notices to say, please go to your local navigator, update your information.
Yes.
It's that time of the year.
Okay.
And you would really want to do it when they say so in a timely manner, because you could either get less coverage if you don't renew in time, or get a loss of coverage if you don't renew
it could be
in time.
canceled then.
Right.
Okay.
Yeah. So it's best to be proactive with it, so that way there's no, because when you really need insurance, you need it to be there.
Well, right.
So it's best to get ahead of it and make
Okay.
sure you have it for the year.
Now, if somebody's situation changes during their coverage period and that they no longer qualify, what happens then?
Well, if somebody, it's good if you have a change in your family size, like if a kid leaves for
Right.
being of age, or if there's a divorce or a death or anything like that, it's definitely good to come in as soon as possible to update that information so it can reflect what you should really be on.
Okay.
And it could go from a Health Connected plan to a Connected Care plan or to a Mass Health plan. It could definitely vary with the changes that you come in with.
Okay, all right, so it's very fluid, but there are options available.
You can come in any time of the year.
Oh, see, that's important.
Yeah, any time of the year to make a change.
Okay.
So you don't have to have, it doesn't have to be open enrollment, or you don't need a special enrollment period to do that. Like if you move, definitely once you establish, come update your address. If you lose a job, you come in, update with the new pay stubs. Once you get a full week's of pay, because some people go to work and they do a few hours to get used to the job,
Yes.
then they start a few weeks later, 40 hours.
Okay.
Once you get a full 40-hour check, you want to come in and present that so we can update your information.
Okay.
And or if your immigration status changes, if you're working towards your green card and
Yeah.
it's been that time that you've received it, you definitely want to send any immigration status in that you have as soon as possible.
Okay.
Yeah.
And what about like a job loss?
Definitely job loss.
Yeah.
Well, if you lose a job, you could either be on maybe a Connected Care plan where you maybe don't have to pay a premium, or if your income is low enough,
Right.
you could possibly be on a Mass Health plan.
Okay.
Yeah.
So there's really no reason not to have some kind of coverage.
Oh no, there's a lot
something
of
for
amazing coverage in Massachusetts.
everyone,
Yes,
yeah.
yes, for everybody.
And I'm glad you pointed out that changes can be made any time of year. I think sometimes there's a misconception that I have to do this before January 23rd, otherwise
Right.
I'm out, right?
Right,
That's not
right,
the
right.
case. Yeah.
Yeah, I mean, you can come in any time to update anything, but definitely when you hear that it's open enrollment time or you
Yeah.
get those letters, you definitely want to act on that as well.
All right. So reach out, either the hotline or the websites, or just stop by one of the offices and,
Please do.
and see what's available. Shirley, anything else you'd like to add?
No, just to continue emphasizing that our navigators are available for anyone in the community.
Thank goodness.
You can schedule, right, you can schedule an appointment ahead of time, or you can just walk into one of our sites and we'll always accommodate.
Absolutely.
Great. Thank you both. It's been
Thank
a lot
you,
of good
Joe.
information.
Thank you for having us.
You're very
you.
welcome. Please come back
Appreciate you.
too.
Oh yes, we will.
All right. Just enough time to check the forecast for you for the rest of the day. Today, increasing clouds, mild temperatures though in the upper 40s this afternoon. The rain moves in tonight. It'll be off and on through the evening hours. And tomorrow we'll start out kind of the same, cloudy and then some more showers in the afternoon. Heavier rain tomorrow night. But it clears out on Sunday with temperatures in the low 40s. A little cooler on Monday, but not bad. Partly sunny and a high 38 degrees. Thanks again to Shirley Fajardo and Ken Moore for joining us from Manatt Community Health Center. Thanks to our crew. Thank you for watching. Monday here in the program, we get an update from the Social Security Administration. Meantime, check out our website. It's qatv.org. All of our latest programs are there, along with news and information, video on demand, live streaming, and much more. For all of us here at QATV, I'm Joe Catalano. Have a great weekend.